Hello everyone. After our last video about Invisalign, we got lots of good questions from patients or just online viewers, and I want to answer a few of them today. Mainly they were focused around how can I take care of my Invisalign aligners or trays basically, because they become yellow, they start to smell, they break sometimes, and obviously you have to pay to get them redone. So what are the few facts you can give us to take care of our aligners? So a couple of the things you need to know. First thing first, you need to wear your aligners 22 hours per day. Not 18, not 20. You have to wear them 22 hours per day, which basically means you wear them all the time except when you eat. When you're going to eat, you have to remove your aligners from your mouth. Now, because I'm working from home due to the whole COVID-19 pandemic situation, I don't have an aligner here to show you. But what you do, you put your hands inside to have them removed. You go from your cheek side and you go from the back. The reason it keeps breaking sometimes is that you are pressing from the front and the back breaks. If you go from the back, from your cheek side, and just push them down, little by little push them, and if it's not coming out easy, usually in the first days they might be a little too tight, push and come forward and push and come forward and push, and it comes out. Please, at least wear them 22 hours per day. Remember that Invisalign is an alternative to having braces done. If you had braces would be on your teeth 24 hours a day. So just because you can remove them doesn't mean that you have to remove them all the time and forget about them and sleep without them and go to a party without them. The whole point for Invisalign is it stays in 22 hours a day, so it does its job and you still look fabulous. Before you eat, please have them removed. Do not eat with them. Not only you can deform the plastic, break the plastic, but also it's not really hygienic. Food can get trapped underneath. If anything, you have to remove them before you eat and before you drink. Do not even smoke with them. Do not have any hot drinks with them. The only thing you can drink with Invisalign safely is water. If you have smoothies and shakes and coffee and tea, it's okay because you're gonna change your aligner in 2 weeks' time into a new one. But they will be discolored, they can break, you might deform the plastic a little bit, but if you have anything hot in your mouth for too long, I had a patient who had golden latte, which is turmeric, and her aligner went super yellow and it's really hard to get the color out. So please make sure you don't eat or drink with them. Before you eat or drink, take them out, put them in the little plastic bag. Also, a very common thing that happens is people leave their aligners in the restaurant and the restaurant throws it out and you have to fish it off the garbage, or it's too late for it, unfortunately, and it's not clean if you fish it off the garbage, obviously. So please make sure that you take the aligner with you when you're leaving a cafe or restaurant. Now, when you remove it, have your food, but before you put it back on, it is very clean, hygienic, and handy if you have a floss and brush with you, a little one in your pocket. Go to the bathroom, floss and brush, and remember, if you don't, you're basically having food all between your teeth and you're pushing it up by wearing the aligner. Not only the aligner becomes smelly and gross after a couple of days' time, but also you're causing gum disease for yourself. Your gum's not going to be healthy enough anymore. And for your teeth to move, you're going to need super healthy gums. What else? I have things written down. I just want to make sure that I tell you all of it. What if my attachments come off? Now, those of you who have had aligners, clear aligners or Invisalign done, you know that on your teeth you have tooth-colored aligners, which work like braces to be able to move your teeth into the correct direction. If those attachments come off, please go back to your dentist because they need to be placed back on. It's like if your brackets come off when you have braces done. If it's not there on that one tooth, all the other teeth are moving where they should, and that one tooth is not. So you're going to go off the track. And what else? Very last thing before I forget, do not throw out your old aligners. So many patients have done this mistake. If your teeth start going off the track due to any of the reasons I explained before, we want to find out up to where they were on track. So you want to have your old aligners to show to your dentist. Not to mention, if you lose or break your aligner right now, or anytime, you want to have the previous one ready. Put it on until you see your dentist and get your broken aligner redone. Otherwise, if you broke the aligner today, you're gonna see your dentist next week to get it redone. Your teeth will move and then you're completely off the track. It's not matching the treatment plan anymore. Everything will go back from the beginning. We need new scans, new impressions, new x-rays, everything. Stay safe, stay at home, stay in touch, and let me know how you go.